welcome. With this, I would like to say a very beautiful evening to everyone out here on the platform of Brainciti. So, welcome, guys. So, do you know the teeth talks? So, since morning, I'm thinking that are my teeth talking to me? Really? Okay. So, something got stuck. What do you mean that? Okay. Am I feeling the pain in my gums? So, what does that mean? So, again and again, the questions are coming in my head. But then I don't have the answers to it because I'm not a dentist, I'm not a doctor. So, to introduce Dr. Basant, he is a CADSS Gothe University from Germany. He's MDS, BDS. He's an entrepreneur in his field of dentistry with chains of clinic, in Jaipur. He's a person who keeps on upgrading his knowledge from international courses from Germany, France, Portugal, and US. He's basically, various papers have got published in national and international journals. He's very quiet a person, with his things on social platform, but he keeps on coming and giving a lot of seminars, presentations on a lot of medias like TV especially. He has been there on Doordarshan, on various news channels to give his presentation and share his journals, the papers what he gets published. He's an enthusiast in sports and very passionate cricketer. And he promotes dental education through various different activities. Along with that, he's a professor who keeps on, passing on the knowledge to others, and that's what he believes in. So, along with this, over to you, Dr. Basant. Thank you so much for coming and joining us.
Thank you, Nidhi. It is a great pleasure to see such a wonderful platform, and the kind of job that you're doing and planning to do seems amazing. It's quite a different platform from which I'm usually used to speaking. It's more of a scientific platform where I speak. But let's take it forward. First of all, I'd like to thank Brainciti for providing me this platform, and especially the founder, Mr. Faisal, and the co-founder, Mr. Yash. I believe Mr. Yash also is in Jaipur presently. I was informed today. And greetings from the beautiful city of Jaipur. I hope most of you must have visited it. If not yet, you should start doing it now. So let me start by sharing my screen. 1 second. Is it fine? Can you see the screen? Okay, great. So again, I'd like to thank Brainciti for providing me this platform. Hope it is useful for you and the people who are tuned in today. So today I'll be speaking on the topic, do the teeth talk? Yes, they do. But the point is, do we understand their language? So I will today try to act as a mediator so that both of you can understand what each other is trying to say. So as being introduced by Nidhi, I'm Dr. Basant. We run a chain of dental clinics in Jaipur by the name of RV Group of Dental Clinics. My passion is dentistry. I can speak, eat, talk dentistry day long. It doesn't stop me. I'm a certified implantologist. I did my implant training from Germany. I have done my post-graduation in prosthetic dentistry. And presently, as informed, I'm a teacher and a professor also. So I was fortunate enough to do my graduation from one of the premium institutes in India, which is College of Dental Sciences, Manipal. I completed it in 2003, followed by my postgrad and my implantology training. And I make it a point, at least before COVID, to make at least one annual training visit outside India where I can keep myself upgraded. So let's come to today's topic. Do the teeth talk? Yes, they do. So I'll start the topic by going through the various headings, which is, do we understand our oral cavity? Before we go ahead with any topic, it is important that we understand the constituents of those topics. So I'll briefly make you go through your oral cavity or your mouth. The three W's about the teeth: what, when, why about your teeth. I'll try to address most of the commonly asked questions which our patients have in their mind when they come to us. The most pertinent thing then which follows is, what is the right way to maintain oral health? Many people ask, should we brush twice a day? Should we brush 4 times a day? Am I brushing too hard? Which is the best brush to use? Which is the best paste to use? So I'll try to address some of these questions. I'll briefly give you an insight among the latest treatments and advances which are coming into dentistry and changing them. Finally, I hope that it remains an interactive session. So you will have some questions at the last. You can always add them in the comment section and we can take them up once we finish our presentation. So let's start with the first thing, the oral cavity. So the oral cavity of the mouth is made up of different constituents. Now, some of it, we are aware of it. Some of it are technical terms for us. The basic ones are the gums, which is the gingiva, which is technically called as the gingiva. The upper teeth, which we technically call as the maxillary teeth set. Then you have the palate or the bone behind your teeth in the upper jaw. Then once we come to the lower jaw, you have the tongue. You have the lower teeth or the mandibular teeth, as we call it technically, and followed by the gums below. So this is the basic about the oral cavity, which constituents are teeth also. So now coming to a teeth per se. Now this is how a tooth looks like, You have the part above the gums, which is known as the crown. Then you have the part below the gums, which is not visible to you, which is known as the root. Now this root is covered by our gum tissue, which is the pinkish tissue that we see in the mouth. And inside we have got the bone. So these are the parts of the teeth so that, when we interact, you are able to understand me in a better way. Now, this is how a teeth is made up of. You hear these stumps usually, which is the enamel, you have your dentine, you have your pulp or your nerve endings. So basically, our teeth is made up of 3 layers. Imagine them as 3 concentric cylinders, one into another. The outermost layer is known as the enamel. This is the outermost layer, which is the protective layer. This is the layer which protects our teeth against any kind of hot, cold, or any kind of bacteria infection. Okay, the next layer is known as the dentine. This is the middle layer. This forms the bulk of our teeth. Sometimes you must have encountered that you have got sensitivity of your teeth. Your teeth become sensitive to hot and cold. This is because of your dentine layer, which is the second layer. Then we come to the final or the innermost layer, which is the pulp. Now, this is the layer which has our nerve endings and the blood supplied to the teeth. And this is the layer which is responsible for pain. So whenever you say that I have got pain in my teeth, that means the layer which is infected is the third or the innermost layer. So you have the top layer, which is the enamel, which is responsible for the protection. It is just like a lamination over your teeth, your mobile screen. Okay, so this provides you the protection. The second, the dentine, which is for the sensitivity, and the third, which is responsible for pain. So many times once you visit your dentist asks you, are you having pain or are you having sensitivity? Technically, for a dentist, these two are two different terms because they make us determine which layer might be infected. Sensitivity is something which you experience for a short period of time, like you drink cold water, you feel a sensation running through your teeth, which might last for maybe a couple of seconds to a few seconds, and then it goes off. So as soon as the stimulus goes off, your sensitivity goes off. Then we have got something known as pain. Now, pain normally remains or lingers on for a longer period of time. It can be exacerbated by a symptom like chewing on it, taking cold things, taking sweet things. But normally it remains even if those trigger factors are not there. Okay, so that is where your dentist try to ascertain whether you are having sensitivity or you are having pain, so that we get a better idea about which layer might be infected. Okay, now with this basic knowledge, we move on to the more pertinent questions. So do our teeth talk? Yes, they do. Only thing, they do not communicate to us in words. They do it by means of symptoms. They always show a sign. Like it might be a black spot on it. It might be sensitivity when you take cold food. It might be food getting stuck inside. It might be pain. It might be blood. So yes, our teeth are talking to us. They're telling us something is wrong. Imagine a tooth like a baby. A baby cannot communicate to us by means of words, but they do it by showing emotions, by crying, by smiling. Similarly, our teeth are also trying to do the same thing. So they show a change. Now it is up to us whether we determine the change, we have an idea what they're trying to say, and we take action accordingly. So remember, they always signal when they need care or help. It is then up to us whether we ignore it or we respond to it. So the basic objective of our conversation today will be to understand these signs, these signals that the teeth are giving to us, and the possible reasons behind those signals, and the remedial actions that we might have to undertake with it. Okay. Now let us address the three W's. We have got various questions about dentistry, about teeth specifically. Why are my teeth bleeding? Why am I having sensitivity to hot? Why, when I eat an ice cream, there is an unpleasant electric current which passes through my teeth? Are baby teeth important? How many times to brush? How to brush? So we will try to address all the what, when, and why about our teeth. Okay. So let us start with the most common question that is asked. In the morning, when you're brushing your teeth, you see a black spot. You are concerned. There's nothing else. There's just a black spot. Is that a cavity? Should I be concerned about it? Should I visit my dentist for it? Is that something which my teeth is signaling me? Yes, it is. If you see something of this kind of a black spot on the chewing surface of the teeth, or something from the front once you're smiling, they indicate yes, there is something wrong. And most likely it's a cavity, or as in layman terms we call it, it is an infection. Okay. Technically we call it as a caries, a infection of the tooth surface which has led to this blackness forming. Okay. Now this is a sign. The tooth might still not pain, there might not be any sensitivity, but this is the first sign that you should look out for, specifically for your kids. When you're brushing their teeth, once in a while ask them to open and see, can you find any of these kind of spots? So what are these spots? So let us, as I told you, this is a dental cavity. So what is a dental cavity? How does it occur? This is a small video which might explain it to you in a better way. Okay. Now, any loss of the tooth structure that happens, that means when the enamel or the outer layer is breached, we call it a cavity. So any hole in the outer layer, any breakdown of the outer layer is known as a dental cavity. It occurs because there is bacteria on our tooth. They get sugar from our food that we eat, as you say, chocolates and everything. They produce acids leading to formation of a hole on the tooth. So these holes are known as cavities. These grow over a period of time, and if not treated, they might, destroy our whole tooth. And this sugar or this layer of bacteria is what we are trying to remove once we are trying to do brushing and everything. So as I told you, this cavity, this is this discoloration that you see, is what is formed because of loss of enamel. Okay, now bacteria, there are three constituents which are very important to forming a cavity. First is the tooth, which is there in your mouth. Second is the bacteria, which are also present in your mouth. And third is the food. Now, this food is what gets stuck on your teeth and which gives bacteria the power to eat into it and causes some hole on the tooth. So this is known as a cavity, and this is what you see as a blackish display. Okay. So whenever you see it, please go and visit your dentist. you will require maybe a filling, most likely if it is in the outermost layer only. So any cavity which is restricted, as you can see in the the second one, in the enamel surface, you will require a small filling. If it is till the second layer or the dentinal layer, you will require a deep filling, but a filling normally is sufficient for taking care of it. Okay. Now, what happens if you do nothing about it? You will say, I don't have any pain. Why should I go and visit a dentist? Remember, this hole or this cavity keeps on progressing. If you are in the first stage of a blackish spot, you might just require a superficial filling, or just a cleanup might be sufficient provided you are able to maintain it clean. In the second stage, your teeth starts to get sensitive to hot, to cold. That means that you might definitely need a filling to be done up. Okay. In the third stage, if you wait for it to go into your nerve ending, you start having pain, then a filling might not be sufficient. You might require something known as a root canal treatment or an RCT. Last, in case you still delay it, you keep on taking medications on your own, you might require a root canal or even a tooth removal. So what is better? Obviously, it is better to reach a dentist in the early decade. Look out for that blackish spot on your tooth. Okay. Now, another question that we keep come across a lot of time by people asking us is, why is it that whenever I visit a dentist, he or she normally recommends me that I require a root canal only? This is the most common, or RCT is the most common term that is heard in dental clinics. If most of you must have visited a dentist, you might have heard this word, sir, your tooth requires a root canal, this requires multiple sitting, and this will cost you X amount of money. You are like, man, why it is always a root canal? To get an answer to this question, the first question that we should ask ourselves is, when do we usually visit our dentist? We usually visit our dentist, especially in a country like India. 99% of the time we visit our dentist only if we have pain. We do not come to our dentist before that. We try all our home remedies. We try a phone conversation with our known dentist. We try some self-medication by a pharmacist. And finally, when all of them fail, we land up to our dentist. So as I showed you in the previous slides, by then the cavity has already reached your nerve endings. We are not left with any choice except to advise you a root canal treatment or a extraction of the tooth. So please try to go for preventive dentistry rather than curative dentistry. As soon as you see that blackish spot, or even if you do not see that blackish spot, go for your regular checkup to your dentist. Do not only visit your dentist once you have pain. Remember how we take care of our four-wheelers or maybe our two-wheelers? We get them serviced at times, at regular intervals. We do not wait for them to break down. We do not wait when they stop on the middle of the road and then try to rush to a mechanic. Similarly, do not wait for your tooth to show you another signal, which is pain, before you visit your dentist. Okay? Now, as I told you, dental pain is one of the foremost reasons for dental visits. Our aim in a country like India is to educate people to make preventive dental visit the norm and not curative visits, okay? The next question that we normally see are people asking us, or maybe, conversion is, my teeth bleed. Whenever I eat an apple, there is bleeding. I can see blood spots on the apple. Or when I brush and then I rinse my mouth, I find blood, when I spit out. Why do that happen? Why are my teeth bleeding? There is no pain. There is no sensitivity. There is no problem, but they're still bleeding. Why is that happening? Remember, technically, it is not the teeth which bleed. It is the gum tissue which bleed. Teeth cannot bleed because the blood supply to the teeth is in the inner layer, which is the pulp, which is not exposed to the oral cavity. So your teeth do not bleed. It is your gums which are bleeding. Okay, now why do they bleed? They bleed because they are again talking to you. They are again telling you, I have a gum problem, a gum disease, which we technically call as gingivitis, or which a layman calls as pyorrhea. That means our teeth have not undergone their regular cleaning process, and that is why our gum tissue are infected now. And that is why when anything is touching, whether it is a food particle like an apple, or whether it is a brush, it is causing it to bleed. So again, this is the right time to visit a dentist, not wait for the next phase, which is known as periodontitis, or a advanced version of gum disease. In periodontitis, your teeth start to shake. They start to develop pain on chewing. So we do not want to wait to this stage. We should first and foremost visit the dentist at the first stage itself, okay, which is bleeding. Okay, again, understand what the tooth is trying to say to you. Then, very important question: why should I, worry about my milk teeth? Or I have a small child, he or she has got milk teeth. Are they really important? Anyway, they are going to be replaced by permanent teeth. My child is going to get a next set of teeth. So why should I bother about the cavities in milk teeth, or brushing in for milk teeth? So this is another thing that we normally ask ourselves. Are they important? Yes. They are equally, or if not more important than your permanent set of teeth. Now, we might ask ourselves, why is that? Why are milk teeth as important as permanent teeth? Remember, similar to the habits that you give to your child when they are young, that is what they might most likely, develop in adulthood. Similarly, the way you treat your teeth as a child, that is the way that your oral habits pertain. Secondly, just like how important it is for the body's growth, is to give emphasis in the early years. Similarly, it is very important for the development of permanent teeth that the milk teeth are taken care of. Milk teeth help us in chewing food. Imagine if your child is not having good set of milk teeth, they will not be able to chew food. They will move more towards a liquid or a sugary diet, okay, rather than a healthy and a nutritious diet. The smile, it's a major advantage. Your child will become shy if they have got cavities or blackish spot on their teeth, in case they lose their teeth early. There's a major psychosocial impact on their social development. The milk teeth are very important for the development of your jaws and face. What kind of a facial profile do you have? That is very important, how your milk teeth are developing. If they are not developing properly, your jaws might not develop properly, and you might not have a pleasing profile. Okay, they're equally important for your speech. There's certain words, like especially in which teeth are very important. Words like F, S, SH. The pronunciation of these words is very important based on how your teeth are. So speech, or the clarity of the speech of the child might be affected. And finally, if you do not have a good set of milk tooth, you are most likely not going to have a good set of permanent tooth, and then you might require treatment like braces, or wires. So it prevents the formation of crooked teeth in permanent age. So what kind of a smile will you like your child to have? The one on the top or the one at the bottom? Definitely the one at the top, and that is where you will see your child smiling better. You know. Okay, this is one thing which we hear daily. Why dental treatment seems so expensive? Everyone say, man, dentists are minting money. The treatment is so expensive. Like whether it is a filling or braces or anything, a visit to a dental clinic sets us back. It might even alter our monthly budget for the household. No, we only seem expensive. We are honestly not expensive. Here from the dental side of the story, dental treatment is not expensive. Neglect is, because you did not come to us trying to avoid us in the initial stages, you ended up in a far greater and a more complex treatment, causing you more trauma, okay, causing and leading to more money. Okay, we have a saying, you can avoid a dentist, but you cannot run away from us. Ultimately, you have to come to a dentist. Whatsoever you might try, you have to visit a dentist at the end, because there is something peculiar about our teeth. Our body has no mechanism in which it can regenerate dental tissue. You might have a cut in your hand. It might heal up on its own after 14 days. But a small hole in the tooth cannot heal up. Our body does not have any mechanism wherein a dental tissue can regenerate. It cannot. If you even break a bone, it will heal up after 3 months. But a small cavity or a fractured tooth does not heal up. No medications help. Only a dental intervention or a dental treatment can help. So please visit your dentist towards the early part of the graph rather than towards the later part. Because as you see, the more the tooth is destroyed, the more is the stack of money that you are paying your dentist. So the more that is, as people say, I just went to a dentist and sponsored their visit to Europe. That is why you came to us very late, because your treatment now is more complex. So remember, dentistry is not expensive, dental neglect is. Okay. Now this is how it happens. If you see this is how the graph goes. You have a healthy tooth, you go to a dentist for regular oral checkup, you just pay for consultation and maybe a cleanup. That is all. You don't have any pain, you don't have to take any medications, and your tooth remains healthy and natural. You visit us in a second stage where there are certain spots, still your tooth does not require a filling, maybe a fluoride treatment or something. It might cause some pain, but still very little money. You come to us at the third stage, you already have a filling, you already have a decay, but it is an enamel only. So we do a small filling, single sitting, no injection, usually no medications, and very little money. You come to us in a later stage, it has become deep. You did not come to us when you saw that blackish spot. You came to us when you started having sensitivity, or when food started getting stuck in your mouth. You end up paying more, you have a bigger filling. Again, similarly, you come to us for a root canal. You end up paying to us for a root canal, your tooth becomes dead, you also have to go for a crown. Involves multiple sittings, involve medications, involve an injection. So again, you are increasing the pain quotient, you are increasing the money quotient, and you are decreasing your comfort level. Finally, you come to us, even you were able to manage the pain with medications from your neighborhood chemist. You come to us when your mouth swelling has occurred, your mouth is already swelled up. We don't have an option, we have to extract a tooth or maybe do a surgical procedure on the tooth. Finally, you come to us when your tooth is already gone. We have to replace it by means of a dental implant. So remember, it is up to you to decide what stage of treatment do you want to come to us and how much money do you want to pay us. So again, I like to emphasize, it is up to you to choose the right time to visit your dentist. We are also more than happy to provide you preventive care because it is more comfortable, it is more long lasting. Okay. So try to choose the right time to visit your dentist. Okay. The choice ultimately is yours. Finally, we come to a pertinent question: how to maintain our oral hygiene. Many people say, I brush my teeth twice daily, but still in the morning I've got a bad smell or a foul smell. Okay. Or doctor, suggest me the best toothbrush to brush, or suggest me a paste which will not let me form any cavities. Which paste should I choose? Which is the best brand of brush? So let us address some of these questions now. Now, which is the right toothbrush? There's nothing like, the best toothbrush. The better question is a right toothbrush. So our first step towards a good oral hygiene is choosing a right toothbrush. Now, if you see a basic toothbrush, the basic part or the top part where you put your paste on the toothbrush known as the head. So the head has to be small in size. That means it should be able to reach all the area of the teeth that you're trying to clean, whether it is the back side of your teeth or your last molar. So it should be a small head size tooth. So depending on how big your mouth is, your toothbrush head size also will change. A toothbrush for a kid cannot be same as a toothbrush for an adult. Okay, so this is something in which your dentist can help you out. Second question which comes to us is, should I use a hard brush or a soft brush? Usually, most of the cases we require a soft bristle brush or an ultra soft bristle brush. So whenever next time you pick up a brush from your neighborhood grocery store, see it might have a reading written on top of it, but it is soft, hard, or medium. Try to pick up something that is soft or extra soft. Then we come to the handle. You know, we prefer something which has got an easy grip handle, something that is easier to maneuver, easier to use. Okay, so this is the criteria to select a right toothbrush for your mouth. Brands do not make a difference, trust me. Okay, now what is the right way to brush? This is also something that many people ask me. Or how long should I brush for? Okay, this is a small video telling you what might be the right way to brush. So we start by holding our brush to a 45-degree angulation to our teeth. A normal brush covers 2 or 3 teeth. We do small back and forth motions followed by small circular motions. Okay, and then we make a final movement away from the gums. So this is what lets you remove your plaque and the food that is stuck on the tooth surface and in between your teeth. Now let us see how do we clean our inner teeth. We clean our inner teeth by an in and out stroke, holding our brush in a perpendicular fashion to our teeth. Okay. Similarly, this is the way how we clean the back teeth. Now we
Here,
finally come and clean the thing known as gum massaging. Okay, so I'll briefly take you through the steps again. First step, hold them at a 45-degree angle to your gums. Back and forth strokes, followed by small circular motion, and then one final stroke away from the gums. You can do it in sets of 2 or 3 teeth at a time. This is for all the outer surfaces of your teeth. Then you come to your inner surfaces of the teeth, which you go perpendicular to the tooth surface in and out motion. Finally, you come to a chewing surface, again back and forth motion. Remember, you have to maintain light pressure. Greater pressure does not mean better brushing. Okay. Now coming to the last question that was normally asked, which is the right toothpaste to be used? Toothpaste do not matter at all, provided you have been prescribed a medicated paste by your dentist. Otherwise, it is just like, almost all the brands of toothpaste have similar constituents. The thing to make out in a toothpaste is your toothpaste has to be age specific. For a 0 to 2-year-old child, your toothpaste has to be different. For a 2 to 6-year-old child, the toothpaste is again different. For a 6 to 12-year-old child, your toothpaste is different. And finally, 12-year-old onward child, the toothpaste is somewhat similar to an adult toothpaste. So whenever you pick up a toothpaste, any company, you see what is the age bracket for which you are planning to use that toothpaste, because the fluoride content of the toothpaste might differ based on what kind of the teeth the child might have. So that is the only criteria to select a toothpaste. That's all. Nothing else matters. Only if you have a specific condition and your dentist prescribes you a medicated paste, then the story is entirely different. Otherwise, for a regular person, every toothpaste works provided your brush is right, and secondly, you're brushing it in the right way. Okay. Now, what are the 5 golden rules that we have for maintaining our oral cavity or maintaining our oral hygiene? First and foremost, brushing twice daily. And I'd really like to see how many people actually brush twice. You can put it in the comment section. Do you actually brush twice daily? If it is a yes, I'd really like to see it in the comment section whether you're brushing twice. Let's see at the end of the presentation how many people actually brush twice. Just put a Y there. Okay. And when I say brushing twice means in a week, you must be at least brushing twice, 5 days in a week, not once in a while. You know, not like that. Okay, I have a party night on Saturday, so before going to the party, I'll brush and then rush off for that Mumbai night out. That does not happen here. You're supposed to ideally brush after you come back from your party. No, okay. So brushing twice daily. Now, when should you brush? One is when you get up in the morning. That is the best time to brush. And second is just before you're about to hit the bed. You cannot have that night glass of milk after you have brushed. If you eat or drink anything except water after brushing, please brush again. We are looking forward in the future where I feel so for some of us, we might have got brushing by the bedside, option that should be available, where you can just have the brushing option available. Maybe then people will start brushing at night. And remember, your child does what he or she sees. The first question when we ask the child is, how many times are you brushing? They say once. We ask, then the parents will be, I always tell them they should be brushing twice, but still they don't do it. Then I ask them, how many times do you brush? 95% of the time I get an answer, sir, once. Well, if your child does not see you brushing twice, how he or she is going to brush twice? It is not going to happen. Then we start hearing excuses. I'm too tired. I come late from office. So just how you have got those extra 2 minutes in your time to check your Facebook and Instagrams, do that. Spare some 2 minutes time and use that for brushing. Just 2 minutes a day, so 4 minutes daily. Second is flossing and using mouthwash. Does not happen in Indian scenario. One mouthwash bottle should be used every month for one person. Now see your household list for materials that you buy every month. Does it include a mouthwash? If it doesn't include at least 2 bottles of mouthwash in a month, that means you're not using mouthwashes, or your spouse and you are not using mouthwash. So mouthwash is not a one-time buy. It is not that Diwali bumper that comes once in a year and you buy it once. It has to be every month and you're supposed to use it. Flossing, yes. Flossing may or may not be required in all the cases. This will depend on your dentist. So you normally, when you go for a preventive health checkups or your regular cleaning, your dentist will recommend whether do you require to use a floss or not. Similarly, the choice of mouthwash, you've got multiple mouthwashes. Again, your dentist is the best person to advise you based on your problems, which is the best mouthwash. Similar, like based on your skin tone, you use different, lotions or creams on your skin. Something similar based on your dental health or how your teeth are, your dentist might suggest a different mouthwash. This might vary from person to person. The third golden rule is rinse after every meal. We always say, whenever you eat your meal, after finishing your meal, you must be going to wash your hands. And if you're not doing that also, you really need to look into your hygiene. Okay, hand hygiene. So whenever you go to to wash your hands, ensure that you just take in tap water, swish it around your mouth for a couple of seconds, at least 10 to 15 seconds, and then spit that water out. So this rinsing, as I told you, cavity starts when a food is on the tooth or stuck. Bacteria only get the tooth when it is there on the tooth. If it is already gone, it will not have any tooth to form a cavity. So this rinsing helps. In case you are in a party or something wherein you cannot do a rinsing outside, just swish drinking water in your mouth and swallow it. It's easily doable. Okay. Specifically important for all those, forehead washers lovers, eclairs lovers, gummy bears lovers who like those sticky food and eclairs inside their mouth. Finally, the fourth and the most important point which is neglected is many people say, Doc, I brush twice, I brush for 2 minutes, I use a mouthwash as you say, but still when I get up in the morning, I've got a foul smell. Or my partner says, or my kid says, that I have a foul smell coming from my mouth. This is normally because you were cleaning the bacteria on the tooth, but you never cleaned the bacteria on your tongue. So you do have specific tongue cleaners which are available, or you can use the back of some of your brushes to clean your tongue. So please make it a habit that after every time you brush, specifically at night, you ensure that you clean your tongue so that you do not have the problem of that bad odor coming out. The last and the foremost important for us also, visit your dentist for regular dental checkups. Do not come to us with pain only. Okay? Come to us, make it a point that you do come to us. Mostly you will require a 6 monthly checkup, or if your dental situation might be severe, your dentist might recommend maybe a 3 monthly checkup. But remember, the keyword is dental checkup before things go wrong, not after things go wrong. You have to take action, or you have to study before the exams, not after your results have come out. Okay, so if you follow these 5 golden rules, I'm pretty sure you will start being more happy with your dentist. You will stop running away from your dentist because you always fear, man, it will be very painful, they're too expensive, and monthly budget will go haywire. None of that is going to happen if you follow these 5 golden rules. Okay. Now, just 2 latest advances, which is nowadays you hear a lot about them when you move to a dental clinic, or even when you see your latest social media feed. The latest buzzword in dentistry is dental implants. Everyone is talking about, everyone is trying to become an implantologist. All the dental clinics board that you see is dental clinic and implant centers or dental implant centers. And every dentist tries or claims to become an implantologist. This is the cherry on the top for dentistry. This is where dentistry is heading. It is almost like the jump is that you moved away from those, ambassador cars and Fiats to now a Merc. That much is the difference between a normal replacement and a dental implant. Now, what is a dental implant? A dental implant is basically a titanium screw, as you can see in the picture, which goes into your bone. This is used to replace a tooth which is badly broken down and which has already been removed. Okay, so this is a kind of a prosthesis which is replacing something that you have already lost. Okay, so now if you remember in at the start of the presentation, I used that my post graduation is in prosthodontics. So I specialize in replacement of missing teeth. So I replace what has already been missing. So dental implants come in my forte or my specialty forte. So this is what we do day in and day out. Now, many people fear it is painful. No, I'll assure you it is not at all painful. It's a simple 10-minute job wherein something that you have already lost is replaced by putting a titanium screw in your oral cavity. Now, again, the question that comes to us is this titanium screw harmful? Again, because it being titanium, it is not harmful because titanium has not shown to be allergic or causing an adverse reaction in anybody till date. Secondly, titanium is a metal which is compatible with MRI. Many people have this doubt. I have a screw in my jaw. Can I get an MRI done? Now, titanium is one material which is MRI compatible, means it is a non-magnetic metal. It is not magnetic in nature. So even if you've got an implant done, you can easily go for an MRI. So this is something that all of us are looking forward in the future. Means not exactly as a patient, but as a dentist, we are looking forward to seeing you as implant patients. Only thing with your health and care is you can, change the spectrum when you come to us for an implant. You want to come to us when you're in your 20s, 30s, 50s, or 80s. That is up to you. So a dental implant has a screw at the bottom. This is what a replica of the root is, which goes into the bone. Then we put abutment on the top, which is screwed in. Finally, you have a tooth or a cap, which your dentist call as a crown. So this is what a dental implant is. Okay. Now, dental implant can be used to replace one tooth, more than one tooth, and even in certain cases, the complete jaws can be replaced with a dental implant. Okay, so anyone and everyone is a candidate for dental implant. Now, one of the common question is, my granny is 80 years of age. Can she get her implants done? Obviously, yes. Age is not a criteria for getting dental implants done. It is how your medical health is. If you are fit enough to get a teeth removed, you are fit enough to get a teeth replaced. So age is never the criteria. Normally, a person who is 40 years of age is not supposed to lose his or her teeth. So most of the patients that come to us for dental implants are people in the higher age bracket or an age bracket of 70 to 80 years of age. Okay. Now, this is about briefly about dental implant. Now, another thing that we see nowadays is, if you have seen ads of Pariniti Chopra on Instagram and on Facebooks and everything, is clear aligners or braces. Now, clear aligners are a way to correct your child's crooked teeth by not going for braces. It is an alternative to braces. It is a way in which you can get your teeth corrected, malaligned teeth, even without getting braces done up or the metallic thing done up. This on the right was the conventional choice. Nowadays, you've got something known as aligners, which can be used to correct your teeth without a person knowing, what is, that you are getting your teeth corrected. So these two things, a liner and an implant, is something that you will hear a lot often nowadays when you visit your dental clinic. Okay, so this is something that you should know what an aligner is. Or you should ask a dentist to give you an aligner instead of regular braces. Okay. Now, I'd like to conclude my presentation today by saying that, dental health is an important parameter for overall well-being for an individual. Remember, a smile can change your world. Okay. If you come home and you find that your child is smiling, your whole stress of the day goes off. If you're ready to fight with your spouse and he or she smiles, most of the time that fight never happens. So you should be confident enough to smile, and that will only happen if you have set off good, healthy teeth. So remember to smile more often. I like to end my presentation by by this quote: "Stay strong, be positive. It is very much required, especially in these torrid times." And I like to again thank Brainciti for providing me this platform, and people who have worked behind the scenes, and the whole team of Brainciti, especially the host today, Nidhi. And if you have any doubts, any further doubts, remember, there's never any silly question. All questions are pertinent, so feel free to ask any of those questions. Okay, you can put them in the comment box. I believe our host will be taking it up. And finally, this is my details. In case you still have some doubts, which you find it later on, or you're not planning to ask on this platform, you can always reach out to us and ask us there and then. Have a great day. Okay. Okay. Now,
So,
Nidhi, should we take up the questions?
yeah, so thank you so much for the session. Any questions anybody would like to ask? So we have one in the chat, that's, doing fossil increase the gap, asked by Arwa Ali. Hello, can you hear me? Hello, can you hear me?
Hello.
Can you hear me?
Okay, I believe that the host today cannot
Uh,
take up.
uh, okay, so we have one question
Okay.
in the chat box.
Anyway, as you I can see in the comment box, only 9 of you commented that you brushed twice. That's good. Still better than the normal ratio of people that you have. Okay. Now another question is, does flossing increase the gaps? Arwa. No, it does not. If you're flossing in the right way, it does not. But you're supposed to use a floss. Avoid those toothpicks. Avoid, we had a very indigenous guy. We Indians are indigenous. We had a guy, he had got multiple gaps in his teeth. We asked him, how do you clean them? Sir, we have an Indian jugaad. I asked him, what is that Indian jugaad? He slyly, took out and cover of a medicine, that aluminium foil that you have, that he took out from his pocket. He had folded it inside at a 90-degree angle. He was using that to floss. No, this is unhygienic. If you floss like this, definitely you're going to damage your gums and you're going to increase the gap in between your teeth. Okay, so you have different flosses available. First of all, consult your dentist whether you're required to floss or not. And secondly, what kind of a floss works best for you. We as Indians are not trained to floss, whereas in the West, you are normally flossing on a regular basis. So, in per se, flossing, if done correctly, does not increase the spacing between your tooth, and you should avoid those toothpicks that you get after every meal at a restaurant. That is what is going to increase the spacing in between your teeth. Okay, now I believe we had a couple of more this thing. How often should we do, Mr. Sarath has asked, how often should we do flossing? Is it once or once daily? It depends on when the food gets stuck in between your jaws, between your teeth. If it is getting stuck in between your teeth after every meal, you're supposed to floss after every meal. The basic premise is food should not remain either on the tooth surface or in between the tooth surfaces. So there's nothing like flossing twice is recommended or flossing twice is recommended. If you have a food particle stuck after you have eaten something, you are supposed to floss and to remove that food particle from your mouth. Otherwise, in general, twice a day flossing after you have brushed, if you still feel that something is stuck inside, you can, do the flossing part. Okay, anything else we had? No, I believe this is it. Okay, we have one new message. Okay, normally flossing is done after brushing. So your order should be you brush, you use a floss, then you followed by a mouthwash. That should be the order that you should follow. Brushing first, using a flossing, removing all the food particle, and finally using a mouthwash. Okay, does the plastic bristles leave traces of plastic due to friction? No. I believe Mr. Venugopalan, a very pertinent question. I believe that he's asking about aligners. Okay. No, these aligners are specifically made up of a biocompatible thermoplastic material. We do not leave any residue. Okay. Even because of friction, because there is no loss of that material. Okay, so you don't have to worry about any traces of plastic being left behind your mobile, behind your, on your tooth after the treatment with liners. Okay, Anjali has asked us, ma'am has asked us, I heard about ceramic filling. Is there a good material for gap filling? Okay, now ceramic is basically a good filling material. Now, is it the ideal material in your case? That will depend on case to case. But yes, nowadays we have started to move away from metal. We avoid metal in the mouth. So earlier, if you must have heard, people used to say, I've got, silver filled in my tooth. It never used to be silver. It used to be an alloy of silver, copper, tin with mercury. Now, mercury is a known toxin. So nowadays, most of the dentists do not use a silver filling because it has got mercury in it. Okay, gold is too expensive. So we have moved to a tooth colored filling material, which is ceramic or composite. So that is one option. Secondly, ceramic is also used for a crown or a cap or a covering on top of your teeth. So in case your teeth has got gaps in between, either you can go for aligners to close the gap, or if you want a quick fix solution, you can get a ceramic crown done, which if done properly looks quite natural and is long lasting. So yes, ceramic is a good material for filling. Okay. Now we have a question of how much aligners cost. Okay. Now, aligners are a wonderful treatment, but the only issue with them is that they are slightly cost sensitive. Okay. They are towards the expensive side. A liner treatment, depending on the case, might range from 1.5 to around 3.5 lakhs. Okay. It's very expensive, but trust me, it is worth the cost. There are dentists who are specifically trained for these aligners who have used them in multiple cases. So, they work really well. And another advantage of aligners is any age bracket person can get it done up. Now, even if I am wearing an aligner right now, you'll not be able to make out whether I'm wearing an aligner or not. Okay. So any person, regardless of their profession, regardless of their profile, can undergo the treatment. Is not restricted to those teenage groups only. Okay. So yes, they are slightly expensive, but yes, they're worth the cost. Then we have a question on the cost and time for implants. Yes, Mr. Naveen. Now, implants, this question is like, if I ask you, what's the cost of a car? Now, your next question will be, what car? Are we looking for a Nano, which is maybe 2 lakhs, or are we looking for a Mercedes, or maybe a Jaguar, or a Land Rover, which is maybe with the price might runs in crore. So similarly, an implant cost based is basis of first and foremost who is doing it. What is the expertise of that person who is doing it? What kind of experience does he bring for? Secondly, how typical or how complicated your case is. And finally, what kind of an implant is being used. Many people try to equate the cost of any dental treatment by the treatment being done up. Like we have got people coming and asking us, man, doc, you're charging me maybe for a ceramic crown 10,000 rupees, whereas the dentist next door is charging maybe 5,000 rupees. Remember, you're not purchasing a 5-star, which might cost 5 rupees all throughout. You're taking a service from a dentist, you know. So based on the expertise of the dentist, the quality of treatment given is the costing might vary. Okay. So a cap or a implant in your hand might cost you the same amount of money, but you want the implanted in your jaw working. So that requires a service factor to be added in. So usually just a ballpark figure, again varies from city to city. An implant might cost you somewhere around 25,000 rupees, and a higher end implant might cost you around 75,000 rupees. Okay. Now, does that mean that if I want to get complete implants in my whole jaw, will it cost me 25,000 into maybe 32? No, that does not happen. Implant, as I told you, is just the base which goes in. So you only have to maybe multiply it by 6 or 8 times per jaw. So with 6 implants or 8 implants, we can support the whole set of teeth of one jaw. So one jaw implant might cost you around 1.5 to 2 lakh of money. Okay. And then time for implants. Now, implants is usually a two-stage procedure. In the first stage, we put the screw in. This normally takes a single sitting, maybe 10 minutes of time. In the second stage, which is usually after a period of 10 to 12 weeks, we put the tooth on top of it or the crown. Okay. So that is usually done after 10 to 12 weeks. You do have some advancement wherein we can do it immediately in the same sitting also. But the usual protocol is 2 sittings spread over a period of 10 to 12 weeks, each sitting lasting maybe the first sitting around 10 to 15 minutes and the subsequent sitting maybe around half an hour. Okay. Another question that we had was, Demerits and merits of fluoride toothpaste. I believe that, see, fluoride is something that you require in optimum quantities. Now, a paste should normally have 1000 ppm of fluoride in it for an adult, as I told you. For a child, the fluoride content in the paste will be less because the child tends to swallow his or her paste. They're not able to rinse completely. So, adult paste will normally have 1000 to 1200 ppm of fluoride. Now, this amount of fluoride is required to make your teeth stronger. Now, fluoride is a mineral which makes your teeth stronger against decay. It makes your enamel stronger. We want some amount of fluoride in our paste. Okay. Now, until unless your fluoride content is very high in your area, normally a preferred toothpaste is a fluoride-based toothpaste only. Only in areas wherein the water content in the water, the fluoride content is very high, you might be advised by a dentist to move to a non-fluoridated paste or a paste with a less amount of fluoride content. Okay.
Okay. Thank you so much, Dr. Basant, for such an
Okay. I
insightful
believe
session. So,
oil pulling.
oil.
No, Mr. Venugopal, I have heard about it. My wife was the other day only talking about it, something on social media. She heard about oil pulling, but to be very honest, not the right person to ask about it. Okay. But yes, this is something which seems to be an alternative way of cleaning your teeth or making them healthy. But this is not something which is there in our medical sciences. So I'm not the right person to ask about it. Maybe you might get more knowledge about it from social media. But yes, I was advised by my wife to read about it because she told me specifically that someone will ask you in these days. And as we all know, our spouses are always right. So this is a lesson for me. I'll definitely read about it and get back to you. And I know she must be grinning on her screen right now, my wife admitting it that, she's the smarter one. But, that's the truth of life, whether I admit it or not.
So, thank you
Okay,
so
I
much.
believe, I hope that you learned something about it. I tried my best to make it simple enough and would have loved to address a gathering in person where we could have interacted more and maybe asked our questions in a better way. Over to Nidhi.
Thank you so much, Dr. Basant, and thank you so much, Dr. Asta, for that little insight. So, I would like to call Mr. Rajiv to share the word, give the vote of thanks. So, Mr. Rajiv is our 50X master coach who takes care of the program. He takes care of a lot of Indian operations, and he's here from Delhi with us. So, over to you, Mr. Rajiv.
Hi, doctors. It was a really very knowledgeable session from your side. And I was thinking that where I have gone wrong in my teeth because most of my teeth are at my age, in 60. I've got lots of ceramic covers on the teeth. So my dentist, she left for 5 years. And now I think after even 5 years, my teeth are a little bit okay, not any problem. But I'm just thinking that I have to visit you and get them checked. What is the position of the teeth? Because she covered with some ceramic or something. I think 6 or 7 teeth before she left for abroad.
No.
So anyway, it was a really nice session, and I hope that this recording or this live on YouTube will be watched too many times because you see people here. I think today being the holiday in Dubai and there was less audience was there, but once we circulate this link, so there'll be lot many views on this because this is a very informative thing, and it's normally people don't understand that you have to have preventive things I'm being an engineer. I can understand that if we don't do the preventive things, then ultimately the cost of repairs in the worst cases is much, much higher. So thank you very much for coming, sparing your valuable time and giving us so much information. I would really love to show this video to my daughter. I just called her. She said, Papa, I'm busy. I'll see it later. So